This is quite the big day for us for Imploy Healthcare as we use this month to launch our paid version. Now, we have a few attendees. I see someone has their hands up. I would like to point your attention to the chat feature, which is in the bottom of your screen. In the meantime, while we get everything set up, why don't I ask a question in the poll and we can get some engagement going that way. Thank you all for joining us.
What we'll do, we'll get started. Unfortunately, you won't be able to see my faces, which might be a good thing. But we'll get started anyway. If there are any questions, pop them in the chat. We'll have time for questions at the end to answer anything. We'll also have a free roam. We just want to say, obviously, a big thank you to everyone who has signed up in the last 4 months. It has been a lot of changes. And what we are going to go through today is essentially what we found from those changes, what we believe the gaps are, what our journey is in terms of releases, the options, and also a savings chart. Once again, thank you to everyone who did sign up. We did have quite a few companies. A lot of feedback was given, which is great. A lot was taken in. A lot, unfortunately, we couldn't take in as well. But we do appreciate everything and everything that everyone did suggest. With the new 2.0 update, there has been a lot of changes for what people have asked, and we've implemented those, and we are currently still in the testing phase with them. Anyone who does currently have an account, you're more than welcome to try all these features. And we have released, which we can share as well, a page which does go into detail about each of these and how to properly use them. What I'm going to do is I'm going to show you those 3 new features. So you should all be able to see the Imploy dashboard now. If you can't, just let us know in the chat. The 3 main things that were released today were the billable tasks, incidents, and bulk invoicing. So what we're going to do, we're going to go from the top down, and we're going to walk you through each of those, how they may be useful for you, and how you guys can use them as well. Where the billable tasks come into play is mainly with the support coordination. But we are also implementing this for HCP providers as well, especially with the new support at home program coming in. A lot of the self-managed or the care management activities will need to be obviously recorded, time tracked, and have a price attached to them as well. So this is where this will come into play. Anyone who's currently using a support coordination system or billable tasks, you might be familiar with how these work. Essentially, what we've got is each support coordinator has their own set of clients. So when we come into the tasks section, what we'll be able to do is create tasks based on each client, assign prices books to them, assign minutes or hours spent with them, and then decide if we are charging or not for the billable task. So what I'll do is I'll walk you through creating one from the start. So here we just have update client's care plan. From the drop down, we can choose the client, and we can either set the charge here, or we can do it inside the model as well. So when this opens up, this is where all the task details will be. So what we have is notes, finance, and any documents attached with this specific task. For the notes, this is where we're going to record everything that we have done for this specific task. So let's say you attempted to contact the client, care plan review, but was not available. We're able to then save this, and if needed, we are able to come back and re-edit it as well. On the financing section, this is where we can record all the tasks, all the charges for this task. So once we do create a primary charge, this is going to be listed here in the finance section. What we are also able to do is assign multiple charges to it. So let's say, for an example, we have another one. This was a visit, for an example. We're able to also assign the time spent for that visit as well as the primary charge. What then happens is all of those billable items for the specific task will then be created a individual billable entry out of it. Once we've updated the total time for each individual task, we can then come here and choose whether it's going to be charged and whether it's completed or not. Once this task is completed, This will then create a billable entry in the client's profile, which can then have a bulk invoice or individual invoice created out. Few things with the task or in terms of filtering. We can filter by outstanding, so any outstanding tasks for each week. We're also able to do daily, how to show weekends, choose from minutes or hours, or show completed tasks or hide them. Now, I have a super admin role here. So what I'm able to do is see all of my staff members under me and their specific tasks for their clients. Depending on the role base that you do assign to each support coordinator, you can choose to exclude this out so that each support coordinator will only be able to see their own tasks for their own clients. With these roles, everything is customizable. So anything you do want to assign to a user, anything you do want to remove or create as read-only, you are able to in the setting. The next big thing that got an improvement is incident reporting. So if we go into a client's profile here, go over to the Overwatch tab and have a look at the AI shift cautions. We can see all of them are now listed here, and with a lot of the feedback that we received, we have removed the recommendations. So what's going to be shown here now is the category, the date, and the shift notes included. Once we do click on it, we can see the details in more option. And from here, we have a new feature added, which is the convert to incident. So let's say, for an example, the medical emergency / client having a fall. This is severity 10. If we want to convert this to an incident, we'll have the pop-up here to report the new incident. Now, it will pre-fill the title and description. The title is coming from the AI summary, and the description is coming from the notes submitted by the support worker on the mobile app. All of these can be removed if needed, and you can put your custom ones in. And down here, we'll have priority and category as well. All that's selected, and we report the incident, will be then directed to the incident page. On the incident page, we have incident details, notes, witnesses and parties, and documents. So if you look over here on the right, on the left-hand side, this is the overview for all incidents. So when an incident is created, they'll be stored here. And when we click on it, this is where we have the individual page for that incident. Now, for each individual incident, we have notes which can be recorded for it. And we do have witnesses and parties. Because I converted this from a shift caution from the client's profile to an incident, the client and staff member associated with that, with the report, are automatically added as an involved party. And we can see their details there. If you do create one manually, you can still come in and add a client or a staff member. Also be saved as an involved party, or if you do want to add them as a witness, you can as well. Now, with all individual incidents, we do have the option to upload documents as well. So with that, any pictures, evidence, statements, etc., we can upload them here. Now, once all of that is done and we are happy and we have decided to close it, what we can do is we can come over to the incident details here, and we can create the summary report. So let's say client was missing the non-slip mats in their bathroom. Excuse my spelling. And if we choose, we could also choose to have a follow-up date, and any summary notes with it. Once it's done, we'll have a closed incident here. Now, for the biggest feature that we have released is the bulk invoicing. So anyone that did have an account with us before may have noticed that the invoicing was a bit of a mess. So what we've done is we've cleaned everything up. We've moved it all into the invoicing section. And this is where bulk and single invoices can be made. For anyone that was using the previous version, you may have created the invoice inside the client's profile, uploaded all the billable entries there, and then come back to the invoicing tab. So with this, it's a little bit different. Everything is now done inside the one tab. So if I come in here and create a bulk draft, what I'm going to do is select the dates that I want to get the billable entries for. So let's go Monday to Sunday. And what that's going to do is that's going to pull all the billable entries and all the clients that had services within this date range and list them all here. Unfortunately, I don't have multiple clients to show, but this is where they would all show here. And there's a few things we can do with this. So you can see here on the top row, we have one service, companion care, and we have another one for travel claim. Let's say, for an example, the companion care, this is going to be charged to a provider or to a third-party contact, whoever you choose. What we can do is for this individual billable entry, we can come here and we can choose who is going to receive an invoice for this billable entry for this client. Now, for the travel claim, let's say you want to send it to someone completely different. What we can do for the same client is we can then choose to send this, create an invoice and send this to a different recipient. And what that's going to mean is when we do create the invoice and generate it, that's then going to, if I just sync it here, it's going to create two individual invoices. It's going to create it for the same client, but because it's getting sent to two individual recipients, it's going to create two separate ones. With this is currently connected with a Xero integration. Now, a lot of you have said that you would like the MyOb integration. So that is what we're currently working on. At the minute, it is just the single Xero, but we are bringing MyOb and QuickBooks as well. So depending on which accounting system you do currently use, you will be able to connect them. All of you can just let me know if you can see this new tab. So with Imploy, we have used a lot of softwares in the past, and we've gotten a lot of insights into what we believe is a good software, what isn't a good software. One of them, especially for the direct supports, is obviously coming down to the rostering and the tools for the support workers itself. Anyone who is familiar with Imploy, you will know about our AI vacant shifts feature. So that was integrated to be a part of that rostering system that we are trying to build. So with the rostering system, with the AI vacant shifts, we have received a lot of feedback saying it is obviously a lot easier in terms of searching for staff members when you can't find anyone. So we've already ticked one of those boxes, which is fantastic. There are a lot more upgrades to come with the rostering. And also, as always, if there is anything that does need to be improved, please let us know. But anyone who does currently have an account, you will see the new view now as well in the rostering, which is the resource timeline. You're not restricted just to that week, day, and month. We also have the resource one now, which you can filter by client or staff. In terms of compliance as well, this is why we've integrated the incident reporting. This is why we've integrated the AI shift cautions. In terms of reporting with the incident reportings, we will have timeline tracking with those. So any updates made with it can be seen for each individual incident report. We have released also 2 more reports. This is targeted more towards the direct support services. So in the report section, when you do log into your account, you will be able to see that there are, under the service delivery, there are 2 different types of reports. One of them is the weekly service hour comparison, as well as the service delivery metrics. What those are essentially going over is it gives you a breakdown for each week of the hours each client had per day. It'll also give you a breakdown of clients who have had less hours one week and more the other, so you can see any differences there if you do need to intervene. In terms of pricing, you may have seen the email that went out the other day. Now, on the website, those prices are set. We have confirmed them. So we will still have the free version, which does include the rostering and the few general features as well, but I'll get into more when we get to those slides at the end. So what is Imploy and how did we get here? 2022, me and my co-founders, we were working together and we decided that a software system that were out there wasn't working for a lot of providers. Coming from a home care provider ourselves, we did have a lot of experience in terms of the headaches with the rostering, client management, the staff compliance. So we do know the frustrations that some people have been through and that some of you are still going through. So that's why Imploy was created. July 2025 is when we did release it to the public. We are very, very thankful to everyone who did sign up and provide all that feedback to us. Without you guys, obviously, we wouldn't have this 2.0 and we wouldn't have these things that people actually wanted. A few things were removed as well because some people said they are obviously, completely useless. So we appreciate those reviews as well. We obviously don't want features that are just taking up space in the app. Like I said before, end of October is when we will be looking to release the plans for everyone. For the better users, like the emails that have been going out, you will also be receiving that better discount that has been discussed. If anyone's unsure on what the actual discount is, feel free to send us an email. Obviously, we want to try and look after you guys as much as possible with all the feedback. In terms of the plans itself, so we will always have the free tier. What that will include is the rostering, the mobile app, the care management, and the staff mobile module as well. It's everything you need to get started. If you're a sole trader, if you're just starting out, we are providing everything for you for free. So you can get started, do the rostering, still keep compliant in terms of staff members, compliance documents, etc. And you can use that. The next tier will be the team plan. So this will include a few more things. Unlimited users, unlimited storage. We will have that Xero as well as MyOb, as well as QuickBooks integration. The automated claims, which I will tell you guys about at the end, which is quite exciting, and the private, which includes the single and the bulk invoicing. A few more things that are coming are also the Vivo checks. So if you are currently using a HR management system, you may be familiar with them already, but if you're not, it will be integrated with inside. So if you do have anyone that you do need to have an automatic Vivo check on, that feature will be available there, as well as the sales and the suppliers module. We'll be releasing a lot more videos and articles on how to use these new features, so keep a lookout. Then we're coming on to the premium plan. So this will have the Proda integration and the SCP built into it. Now, a lot of you have been asking about the Proda and the STP. I can assure you that they are still under the testing phase. Just due to the compliance with the ATO, there are a lot of compliance checks with it. Once this is released to it, we will give a full update and a new webinar for each specific one. So for the Proda, we'll have a full webinar, and for the single touch payroll. Also included in the premium will be the AI making shift allocation, as well as the 24/7 support by email, phone, as well as a accounts manager. Individuals who are maybe part of a franchise or are looking to start a franchise, we do have that franchise group configuration in terms of the locations and hierarchy in terms of role. A few more things that is included with all of them is the integration, AI features, templates, dedicated to our support, and the compliance guides. We have partnered up with Aged Care Choices. If you are familiar, you may know a little bit about them. But with the sales module within the app itself, we will be able to have a direct access to referrals. We're just going over what a comparison would look like in terms of not using a software and using a software with what we've currently got. Without a software, in terms of rostering with 50 clients and 25 carers, per month, you may be looking at 45 hours per week in terms of rostering, 25 hours for care management, 50 for administration, and 35 for accounting. With the rostering features that were just released, as well as the AI vacant shifts, we are predicting that would come down to a 15-hour per month timeframe. All of this is obviously subject to change and depends on each one. But just with the automation that we do have in place for what we currently have with our own clients, these are the statistics that we have seen. So having everything within that one place for the clients, having all their compliance documents, having all the the checking as well in terms of, when something is updated, when something is changed. Having it all in one client's profile, we have seen has been an improvement. And this is coming from a few surveys that we did send out to people. So if you did submit these, thank you very much for them. Now, this new one as well, accounting, this comes with the bulk invoicing. Now, with the bulk invoicing and the ability to select multiple recipients for the same client, we do believe this will significantly decrease the amount of invoicing. Now, this doesn't include claims. This is direct invoicing itself. For the claims, obviously, when that proto integration does come out and having that direct connection, the only thing that would need to be had from user input is obviously checking those billable entries before pressing submit and sync. That is pretty much for this webinar itself. There are a lot of things that we obviously do want to release to you guys. There are a lot of things to go through as well, but unfortunately, we can't go through everything in one go. There's two things that we're going to do now is you can feel free to scan the QR code and book in a demo. If you've already booked one in, feel free to book another one in and I can run you through everything again. What we're going to do is I'm going to go back on to the live app and I'm going to take some questions from everyone. And if you do have any questions, pop them in the chat.
That's the voice of Joshua Dean, the co-founder of Imploy Healthcare. Now, he's one of three, and he's the creative mind behind the UI that you see today. Mr. Dean, I do have a few questions for you from the chat.
Of course.
All right. Here's a question from Omar. He just asked this. What if there are multiple recipients for the same clients during bulk invoicing?
So like I was showing before, on the draft when we do create one, where's the one that I was creating before? Let me try and get a good example for you. Where's this one? No, this is a dot one. So like this one here, for an example, we have two clients and they unfortunately only have one billable entry each. But let's say, for example, they had two billable entries. What we can do is for each billable entry for each client, we can come in and choose the different company that we do want to send each individual billable line for the same client. As well for these, let's say there are multiple, let me go back to a good example for you guys. All right, here we are. So let's say, for example, for this client, for Martha Blinkers, we have multiple billable lines. Let's say we have 6 for an example. What we can also do is we can also come in and click this tick box here. And what this will do is this will exclude it from the invoice generation. So if you only want to send one or you want to send all of them bar one, you can come in and exclude that as well. Now as well, let's say for an example, there is a client who you want to completely exclude from it. Let's say, for an example, for these clients, you're doing the invoicing, but for Martha, for an example, you want to do a claim via CSV upload. You can come in and you can just choose to exclude the whole client in general. From this invoice generation, what that'll do is that client and the billable entries will no longer be included in the invoice generation. So there is a little bit of freedom with that in terms of excluding single billable lines or excluding the whole client.
So we have another question from Doug who wants to know if you can take a look at the AI scheduler built into Imploy.
The AI scheduler, the vacant shift, I'm presuming?
Yes.
Yeah, of course. Let me create a good example for you here. Let me delete these so we have a clear view of everything. Say for an example, right here. I'm just gonna, what shifts do I have here already actually? Who we got? We got Martha. Yeah, we can use that one. And that is one metal. Beautiful. Let me just get a client so you can see the full demonstration of it. I believe, nope, that's the wrong client. Here we go. That's not one. I'm going to put this one as shift pool. I'm going to do it as 2 hours. I'm going to save it. What I'm going to do is I'm just going to create another shift as well, just so you can get better understanding with it as well. And for this shift here, who can I put? I believe, no, not that one. We'll go Martha again. And for this one, I'm going to assign myself again to it. So the appointment type, 2 hours, we can see it. So for this example here, on the Thursday, the 16th, we can see here we have a shift, which is Martha Blinkers. I'm going to this one, and it is at 1 p.m. to 3 p.m. For this domestic cleaning shift here, we have the client with Alice Nolan, and we can see that the employee is NA because it's been added to the shift pool. And just for an example, I've added another shift with myself and Martha again in the afternoon. So what we can then do, what day was it? 13th, Thursday the 16th, and the client was Alice Nolan. We can come over to the vacant shifts tab here. And we'll see on the vacant shifts, we have the client, Alice Nolan. We have the date, the time, the address, who the care manager is, and what it is for. So what I'm going to do is I can either assign it directly to a staff member if we do know who is going to be going to that shift, or if we do press AI Assist, what this will do is it will create a 30-kilometer radius around the client's address, which is 43 Porteous Road, Sorrento. In that 30-kilometer radius, it's going to gather all the data for any support worker who lives in the area or any support worker who's currently completing a shift in that area. And what it's going to look for is, has any of these people previously been to the client? How many hours are they working that week and that day? What's going to be the travel distance time and kilometers from their current clients, with also including the vacant shift? What I'll do in a order from top to bottom, it will give you the best match going down to the least suitable for it. We can see here for myself, for an example, we can see that the travel time, because these addresses are very close to each other, the appointment time, travel time is only 1 minute, 0.7 kilometers, and I'm only working 10 hours this week. You can see here as well, I already have 2 appointments nearby for that day. If I click view schedule for myself, what this will do is this will pull up all the shifts that I have for the 16th of the 10th, which is when the vacant shift is. So you can see for the 16th, I have a total of 3 appointments. If this one is included, I'll be working 6 hours. I'll have total travel time of 2 minutes, which is very nice. And I'll also have a total travel distance of 0.9 kilometers. If we come down here to the scheduled shifts, what we'll see is we have the shift with Martha. We have the travel time in kilometers and time from Martha to the vacant shift, which is Alice. We have Alice's shift. We then have the travel time from Alice to Arthur. What it's trying to say is, and it still needs a little bit of tuning, is move the appointment to 3:15 for back-to-back scheduling. So what it's saying is on the roster itself, I'll go back to the day view, and it was the 15th, I believe, or the 16th.
16th.
What it's saying is, because there's an hour gap and it's only a minute travel time, it's saying that you could move this shift up more so that their support worker isn't waiting, and it is that seamless end-to-end shifts going forward. Now, obviously, some clients that do not want their shifts moved or they cannot have their shifts moves, but it's just providing that recommendation, obviously, in terms of the SCADs, the awards, in terms of paying them with those breaks as well, and the travel distance. So that's what it's all taking in with those AI recommendations. We are obviously not trying to build something that's clunky and doesn't have everything you need. If something is critical, we will add it in, and we will get it added in promptly. So just let us know if there's something that you say, look, Josh, this is, why do you not have this? We really need it. Let us know. Send us an email, give us a call, and we'll discuss it as well.